Hello everyone, welcome to the new episode of Ask the Doctor. Today we have with us Dr. Vikram Beliyappa, a senior gastrointestinal surgeon from VSH. Doctor, welcome to the show.
Good afternoon, Santosh. Thank you.
Yes, so Doctor, first of all I want to ask you one thing. What is gastrointestinal surgery or what is gastrointestinal department?
So, the Department of Gastroenterology and Gastrointestinal Diseases handles all the diseases related to the abdomen and the intestine and the organs within it. So, ನಮ್ಮ ಹೊಟ್ಟೆಯಲ್ಲಿರೋದು ಪ್ರತಿಯೊಂದು ಅಂಗಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟದ್ದು. So there are two parts of it. There's a medical part of it, which is handled by the medical specialist, and the surgical side that is handled by us gastrointestinal surgeons. So it involves simple problems like, for example, gallstones, an appendix, or hernias, to a more complex problem like liver problems, liver tumors, pancreatic tumors, colonic tumors, and other medical conditions within the abdomen.
How different is this department of gastrointestinal surgery at VSH?
So what we have done at VSH is to try and create an integrated department. So we have the medical and surgical part of it. We have a very good support from other supporting departments so that we get the best results for our patients. We have state-of-the-art imaging and the scanning kind of. So we have one of the few hospitals that has a very advanced CT machine that actually is very, very good for abdominal imaging or scanning of the abdomen. We've got a very good anesthesia department that gives us excellent care for patients with gastrointestinal surgeries because we want them to recover quickly, eat quickly, move quickly. We've got a specific ICU that helps in helping complex surgeries recover fast. We have a very good dietary service that is tailor makes the food to what we want for our patients who have gastrointestinal surgery, because that also helps in their recovery and finally getting back home fast.
Very nice. So what are the new techniques or technologies that are using at VSH for gastrointestinal surgery?
So we have two or three things that are unusual. One is, of course, the standard. We use a lot of laparoscopy, which everybody knows, which is keyhole surgery. We have some of the best state-of-the-art laparoscopic equipment, and we are using a few different techniques, which is ultrasound guided surgery, which helps make our surgery even more accurate, especially for specific things like in the liver, to find out specific areas where the liver has a tumor, which that has to be removed, in the pancreas to remove certain parts. So that makes our what I would call image guided surgery so much more accurate and much more precise. Then we have what is known as a protocol, which is more of a planning wherein we advanced and early recovery protocols for patients. So a patient may have surgery and then stay on in hospital for very long, but with this kind of a protocol we are able to get them moving faster, eating faster, and going home faster. We are also going to be getting robotic surgery very soon. So these are really the new technologies that we're going to be having at our hospital.
Okay. What are the kind of surgeries that has performed from the Department of Gastrointestinal Surgery at VSH?
So I would say, we've handled all kinds. So starting right from the top, we've had patients who've come with a food pipe, issues. Sadly, we've had people who have consumed, a poison or by mistake drunk something, and the whole food pipe is completely burnt out. So we've used a special technique where we create a new pathway for the food to go down. And these are called esophageal replacement surgeries. We've done the whole lot of routine surgeries like gallbladder, appendix, hernias. We've done liver surgeries where we remove liver tumors. Then we've done a few unusual surgeries wherein we've had people actually lose a kind of a small piece of we had a stent that actually strangely migrated when somebody tried to put it into the heart, and it had gone through a blood vessel and got stuck near the liver. So like that, we've done the whole array of surgeries with all the organs involved in the abdomen.
Okay. So how many surgeries have been performed and what have been the results?
So VSH on Vittal Malya Road, I think you must know, is probably was probably one of the first hospitals, premier hospitals in Bangalore, which was called Malya Hospital in the earlier days.
Yeah.
So it's now become VSH, just been about a year and a few months that it's been reopened, fully renovated. So since we've a new team, our whole team got in. So since inception to now, we've done about 400 cases, and we've had a very good success rate, above 98%, and a very good outcome in all our surgeries.
Okay. So what are the initiatives that have been taken from VSH to make to take good care of patients?
So I think the most important thing is to make sure that patients have a good experience. So most of the patients are counseled in detail regarding what is the procedure they're going to have, what do they expect during and after the surgery, what is the duration of their recovery. So that I think is comes into the nutshell of counseling the patient so that the patient knows what they're going to get. The other aspect I think which everybody always asks, and I think it's a common question, is what are the finances involved? So how expensive, and can there be methods by which we make it more economical? So I think one great advantage has been, it's a premium facility, but we've tried to make it as affordable as possible by giving people the opportunity of using a daycare service. So, we shorten the stay of the patient in the hospital. They come in early in the morning, they have surgery, and by evening they're home. And that also is helped by certain enhanced anesthesia techniques, which makes people's recoveries much faster. On the financial side, also we have a kind of a tie-up through the hospital with various microfinancial institutions, which help convert the cost into a no-cost EMI. There's no interest EMI, sorry. So that makes it more affordable for people. There's no down amount that they need to pay, which is too much of a burden for them. They can opt for this thing, which makes splits the cost into a smaller part.
Okay, cool. So what are the future technologies that department is planning to incorporate?
So I think the most important one that is going to come very shortly going to be there is going to be robotics. So I think that will enhance the complexity and results that we are able to give to patients. It is a new methodology of doing surgeries, and I think we will be getting that pretty soon. We are also going to get a more integrated OT, wherein we are going to be able to do multiple activities on the patient, what we call kind of a hybridized process where endoscopy and laparoscopy will be able to be done together. So that really helps do many surgeries and surgeries with a more complex process with the minimal invasive techniques.
Okay. And one more personal question, this is out of my curiosity. So many people will get confused with acidity for so many other gastrointestinal problems. People will think this is just a gastric and take some random tablet, and people will ruin their gastrointestinal system. So what are the tips that you want to tell to people regarding this?
So I think the first thing starts off with how to prevent it. So I think good habits. I think before if you can avoid coming to a doctor, great. So the best thing is have healthy habits. So eat healthy. I think the two biggest problems are smoking and alcohol, which trigger acidity to a great extent. So if they can both be avoided, nothing like that. Eating healthy. I think we live in the generation of ordering in food. Everything is at a click of a button. So I think if you can minimize eating out. It's not that one can make it zero, but try to make it the least amount, and avoid eating foods which tend to be really overly spiced. But I think predominantly it's the ingredients that matter. So if you're cooking at home, you're in control of your ingredients. And I think the next question I would say is, if you're going to be treated, if you have acidity, as you said, sometimes there are slightly more serious problems in the abdomen that may be missed because people think it's acidity. If your symptoms are not getting better with whatever medication you've been taking, I think you need to go back to your doctor and mention it, because that has to be relooked. And that happens very commonly because we see people who have been taking acidity tablets for about 2 to 3 months. They're not really getting better. They just keep changing a brand here and there. But if you're not getting better, you need to go and give that feedback to your doctor.
And the funny thing is, so many people are not even ready to accept that they have a problem or visit doctor. What is your opinion on that?
So I think that's we all like to live in denial, and I think that's I think the greatest human trait. So I think the fact that I think one is always meeting a doctor is not a pleasant experience. So sadly, people try to avoid doctors and hospitals. But the reality is that if there is a problem, you have to address it. And the faster you do so, the earlier you come in, the simpler is the treatment, the more effective is the treatment. And strangely, the cheaper it is, because if you come early, the treatment is faster. So I think the most important thing is for people not to overreact to a problem, but realize that, when something is troubling you, do meet your doctor, because it may not be anything else, and the doctor may actually end up telling you, you don't have to worry. So as the old saying, stitch in time saves 9. Come in as quick as you can. Tell your doctor what the problem really is. And I think the other aspect I also would like people to is that if sometimes the first round of treatment doesn't seem to really help you, get back to the person, because then there may be actually something else. So that feedback is important.
Yeah. So yes, that's very, very true. No one knows better than doctor. So please, if you have any problem related to gastrointestinal system, do visit VSH, and VSH have the better system, better surgeons, better doctors to rectify your problems and give you a solution. So doctor, thank you so much for coming here and sharing your knowledge with us and for your time. Thank you.
Thank you, Santosh.